Communication from the Presidency. Number 15, the High-Level Task Force on COVID-19 Pandemic. Today is Sunday, the 5th April 2020, Juba, South Sudan. South Sudan confirms one case of coronavirus, COVID-19. On behalf of the President and the Chairman of the High-Level Task Force, I would like to inform the public that on Saturday, 4th April 2020, the Public Health Laboratory tested and confirmed a case of COVID-19 in an individual. The suspect presented to the UN clinic on the 2nd April 2020 with fever, cough, headache, and shortness of breath. The Ministry of Health's Rapid Response Team went to the clinic and collected samples the same day. The initial test came positive. A second round of the confirmatory test also returned positive. The patient is a 20-year-old female who arrived in the country from Netherlands via Addis Ababa on the 28th February 2020. She has no history of underlying or pre-existing illness. She is currently in isolation and is in good health. The Ministry of Health is leading a full outbreak investigation with the World Health Organization and the Centers for Disease Control and Prevention, including identifying and following up all the possible contacts and next steps. The government of the Republic of South Sudan seizes this opportunity to reassure the public to remain calm. The High-Level Task Force has put in place relevant public health measures over the past 2 weeks. Social distancing, as you can see between us now, social distancing is the only way we can minimize the risk of contracting and transmitting the disease. The government urges members of the public to strictly observe the rules of social distancing. 1, no physical contact outside of household, including no handshaking, no hugging. Keep 2 meters, if you think American, 6 feet, distance between two individuals. 2, wash hands regularly with soap and water. 3, stay at home. 4, employers, both public and private, should encourage their employees to work from home. 5, avoid crowds at any places, including marketplace, tea stalls, shisha places. 6, nightclubs and bars must remain closed. 7, restaurants will only provide takeaway service until 6 p.m. 8, shops and businesses selling non-food items must remain closed. The government reinforces early resolutions on curfew, starting from 8 p.m. to 6 a.m. Additionally, the Presidency assures the community of the measures that are put in place and will continue to be reinforced. These include: 1, the government reinforces all social distancing measures made to date in the preceding high-level task force directives. 2, The government will effectively implement these measures in a community-friendly manner, engaging with the leaders at the local, community, county, state, and national level. 3, the Ministry of Health will continue to rapidly increase and enhance community and household level hygiene capacity, including hand washing stations with soap distribution, particularly to high population density settings. 4, the government, as listed above, will ensure effective closure of locations that have population gatherings. 5, the Ministry of Health is expanding the bed capacity at the John Garang Infectious Disease Center in the coming weeks. 6, the Ministry of Health is training more health care professionals. 7, the government directs postponement of weddings, festivals, and other sporting and religious events. 8, the government directs that funeral gatherings be limited to less than 5 at a time. The high-level task force on coronavirus pandemic remains seized of the situation. This is our situation. We have one positive case. Thank you very much.
Yeah, this is a case that was reported to our rapid response team on the 2nd of April. And our team rapidly went to she actually presented herself to UN clinic. And our team went. They found that she meets the case definition for COVID-19 because she had fever, she had headache, she had cough, she had temperature, and she had also shortness of breath. And so samples were taken, and the initial test came positive. We had to do a rerun of a confirmatory test yesterday, and we got the result late, and which also was positive. So this morning, we had to report that to the head of state. So first Vice Chancellor last night informed the head of the state, and a decision was made to declare today, and exactly that's what happened. This patient came from Netherlands about 5 weeks ago. Precisely, she arrived in the country on the 28th of February, and she did not complain of anything. She's young. Via Addis Ababa, yes. She's a young person, 19 years old, 29 years old, and she doesn't have any underlying medical conditions or any pre-existing illness. So the most important thing to note at the moment is that since she presented with the symptoms, she has been in isolation, and currently she is still in isolation, where she is undergoing medical care. She's in good health, and she will be monitored over the next few days.
Is she quarantined at the official?
Yes, we have now undertaken and launched a full-blown outbreak investigation, working together with our partners, and we have to get hold of possible contacts that she has been with since she presented with her symptoms, and that's how we can contain the disease. Given that she has been here for 5 weeks, anything is possible. Possibility of having contracted the disease inside South Sudan is a possibility we have also too, and therefore our investigation will really try to get down so that we can be able to get...
Let's jump up what you were saying. So when she came to the country, she was not quarantined immediately?
She was quarantined like anybody else who came that time. and she did not show any symptoms at the time. And one thing to note also is that this disease is a new disease, so not much is known. Whether the cut-off time of 14 days is the rule for every case, or there are exceptions where the symptoms may delay beyond 14 days. So those things are not really very clear. There is already scanty information out there which is not scientifically verified that it can actually go beyond 14 days, particularly among the young and the fit and the healthy ones. They may remain asymptomatic for quite a while. So these are some of the things that are possible. But what is important is for us to contain the infection. And to contain the infection is to get hold of the contacts. Those who may need to be tested will have to be tested. Those who need to be monitored over the next few weeks will have to be monitored.
Can you elaborate on that? Are you talking about the contacts, those who came on the return on the plane there, or those you...
We will definitely go back to...
Why did she have to come to the country?
She is working...
Non-essential travel has been advised.
She is working in the country. She works for the UNDP, and she was coming back to her place of work. By the time she came, there was no restriction on movement of people in South Sudan because the risk was still perceived to be low, and so people were still moving as usual. We don't know whether she's essential or not essential as some of the UNDP, but that's the information we have. And it's the UNDP also that decides whether a particular staff is essential or non-essential.
So where do you begin retracing some of the contacts? Where are you going to begin?
Well, the tracing of contacts will likely depend on the information that we have and that she will provide. One, according to the guidelines, the contact tracing starts 2 days prior to the onset of symptoms. So if her symptoms started on the 2nd, then we could go back up to 30th of March. Then because this is the time actually the person becomes infectious, that time a person can pass infection to others as of 30th of March. So we can go back to that. But of course, for the wider benefit, we are also interested in seeing information about people who were with her on the day she arrived in the country, and where she lives, where she works, the driver, the restaurant she frequents, the shops, anybody that they might have come into contact in the last few days.
What is the general situation that the task force is dealing with? What would you say? You have been taking some measures, precautionary measures, and what is the general situation like with regard to your preparedness and your response?
First of all, over the whole world, the risk of COVID-19 remains very high. And you must have seen that in the media, how rapidly numbers are building up. Around us, almost every country around us has developed local community infection and transmission, which poses a lot of threat on us, given the fact that we have large South Sudanese communities in countries like Uganda, like Kenya, Khartoum, or Sudan, for that matter, Ethiopia, Congo, and all these are countries that have already developed local transmission. And given the fact that also we have tribes and communities that live on both sides of the border, so it's the porosity of the border. So this, of course, put a lot of pressure on us.
What has been done to
ensure that?
We hear that people were sneaking across the border.
Oh yes, I mean, those people are sneaking through the borders, through illegal ways, and of course that is a crime to enter into a country without any due process. And of course those who are found will be subjected to quarantine, and afterwards the law can take its course. But the most important thing is the borders have been closed. And our people, our security or border control officers, must ensure that they seal the borders so that you minimize the risk of people who are carrying the disease coming into the country. This is very important. The porosity of the border, of course, is quite a challenging thing. You take a country that is surrounded by 6 countries and have about 56 official entry points into and from those countries. So you can imagine also the other so-called panya roads. And then you find a situation where, for example, in Western Equatoria, I have gone to a place in Western Equatoria about 4 years ago, and while we were seated waiting for other colleagues, a woman came across the border. The border was just some few meters away from us. The woman came across the border, coming into the neighborhood, and when I asked, I was told she went into her farm. Her farm is on the other side, it's in another country. So that person, how do you control their movement? So these are some of the issues that we are dealing with.
Most of the risk now seems to emanate from the NGO community and the UN agencies, and there has been a pushback by them to the restrictions that were announced by the government on the movements. What is the latest on that?
I don't know what you mean by pushback. Like, in the fact is this: if you want to limit the risk of exposure and transmission of COVID-19, you have no any other way other than social distancing. That is the only...
I'm talking about the travels that they have been conducting, whether they are humanitarian or... And sometimes they have to bring people in under the pretext that, they have to...
No, those people who come in also are subjected to a lot of scrutiny. We are saying, before they come in, we have to check whether their presence in Sudan, in South Sudan, adds any value to whatever work that they are doing, whether it be humanitarian or whatever. That is one. Number two, once that information is verified and the task force judges that their presence in South Sudan is important for a reason or another, then the next thing is they must present a verifiable evidence of quarantine where they are.
And then subjected to another quarantine.
Yes, and when on arrival here, we subject them to another quarantine. You look for the case of Korean contingent, for example. Last week, the higher level task force granted them a special permission to come into the country and do their rotation. But when further evaluation was made, it was found that the contingent was too large, and no matter what level of precautions were in place, you still have a high risk of getting the disease into the country. So in the last meeting of the task force, a decision was made to extend their stay in the country under quarantine for 3 more weeks up to the end of April. At the end of April, another evaluation will be made whether their coming will be safe to the country or not. So they are being taken care of or are being decided upon on case-by-case basis.
Other than the positive case that has been announced, any other alerts that you are dealing with?
We are receiving alerts on a daily basis. It's a routine thing now to get alerts, and which is also something positive. One, it shows that our surveillance system is sensitive and is picking.
Alerts?
And what do you mean?
Like how many are you dealing with, and any alerts you can speak about?
Today, there has not been alert this morning, but we are investigating alerts for yesterday. There are already 3 tests which are ongoing. We'll get the results sometime this evening or late at night or tomorrow morning. And those alerts, of course, they come from people who, in a way or other, have been, at least for themselves, they perceive that they were in a high risk, either they came from a country that already has a disease, or they have been in contact with somebody they heard of, he has developed a disease wherever they have been. So this is the nature of alerts. There have been very few people who investigated, did not travel anywhere outside South Sudan, but almost everybody that we investigated has been to a country that is COVID-19 positive. And majority of these are UN workers or NGO workers, international organizations. Yeah, results have been negative. This is the first positive result we got.
There have been those restrictions, the curfew, and many places have been closed down, but I'm sure you may have heard that there are some lapses here and there.
Oh yes, sure.
Even
Those
in
things.
the church, people are still praying.
Yeah.
And
So
other
those
places.
things are still
How
there,
do
and
you
of course
respond
this
to
is. Of course, there are many ways that such issues can be tackled. One, of course, is through engagement. The church people need to understand, like this so-called young Emmanuel Jing, they need to understand that if they read Bible and they understand Bible, quarantine is not something new, it is in the Bible. They just give themselves 1 minute and go to Isaiah 26 and they will find that there was a disease, there was a plague, and Isaiah came and said, go inside your houses, close and lock your doors behind you, remain inside until the wrath of God has come to pass. That is in Christianity. That was quarantine. It happens also during the time of Muhammad. There was a Khalifa called Amr ibn al-As. Amr ibn al-As was the one actually who brought Islam to Sudan. He was appointed a ruler of Sham, the current day Iraq and Iran, Iraq and Syria. There was a plague that killed 2 governors before him. When he came, what he did was he told the people to go into mountains, stay in their mountains. Each goes to their mountain with their family. They remained in their mountains until the plague was over. When they came out, no single person was lost. This is the religion. So what is very particular about the religion of today? The fake priests who are talking about fighting the virus in the skies of Juba. Okay, we have a positive case today. Why did they allow it to happen? They have to listen. It is not up to them. And the task force will not tolerate this for too long.
And you would still advise the public to take the precautions?
We will engage them. If they don't heed to the engagement, definitely they will apply the legal measures against the church, against anybody. And we are ready to take away the keys. They must understand that this is an extraordinary time. It is like people are under emergency. And in such situation, it is not business as usual.
Is there going to be a lockdown?
Well, the lockdown is dictated by the situation, so we cannot talk of things that are still ahead of us.
But it has not been announced.
It has not been decided, it has not been ordered, and the government doesn't have any intention at the moment to impose a lockdown.
Thank you very much.
Thank you.